Hey everybody. Today I wanted to talk about my VSG journey or vertical sleeve gastrectomy bariatric surgery journey. And the reason I wanted to talk about it today is because I don't know, there's a lot of videos out there and everybody has a lot of great content, but I feel that I have some insight on it because I work in the medical field. Now, yes, I have chosen to do the process for the vertical sleeve gastrectomy, and it wasn't an easy decision. If you would have asked me a year ago if that's something I wanted to do, I used to always say it's an unnecessary surgery. I don't think that's something for me. I don't like surgery in general. But I've changed my mind. And the reason I've changed my mind is because I've had some health issues that has required medication, and I've seen the benefits of having the surgery. And working in the healthcare field, I've seen a lot of the patients that come in to have the procedure, and I've gotten to know the surgeon that does that procedure at our facility. Now, I don't want to say his name, and I don't want to say his or the facility that I work at, because just because I work there and I'm in a management position there, I wouldn't want to put that information out. So I've worked at this facility for about 2 years now, and I've seen all the patients come in, the benefits of it. I've seen how good the surgeon is with his patients, and I still took me a really long time when I decided that I might want to start taking this seriously. Is when my own physician put me on medication for a healthcare issue I'm having, and he said I would benefit from having or losing weight or weight loss, and I decided to go to the surgeon now. I've been wanting to make the appointment for a really long time. Back in 2017 is when I started considering it, and I didn't make the actual appointment till March of 2018. I said, what's the worst that can happen? Let me just go see him and see what he has to say, what are the benefits to me, and if it benefits toward my healthcare issue, my personal health issue. I went to see the surgeon back in March of 2018, and as I felt, he, very knowledgeable, gave great information, and not that he convinced me, but he told me the benefits of what having the procedure done could do to my own healthcare benefits. No one wants to be on medication for the rest of their life, and that's basically what I was facing. And not that he guaranteed me that I would not be on the medication anymore, but he did say that a lot of his patients, once they had the procedure, they would no longer require this medication. So, I talked more with him. I brought my husband because, of course, I wanted the support of my husband, and just his overall information would be good toward my husband as well. So we talked with him. Great physician, great surgeon. I mean, everything I saw that he portrayed to the patients in the hospital, he was giving me the same, consideration and care. His staff, of course, very great and knowledgeable, and they told me what the requirements were for my particular insurance. Now, I have United Healthcare, and the United Healthcare I have is group-based, meaning it's through my hospital. But they follow the guidelines of traditional United Healthcare. So meaning my group, although they do cover bariatric surgery, they follow the United Healthcare guidelines as far as what is required to have the bariatric surgery. So, like I said, I have United Healthcare, and the requirements that they told me were a little bit confusing because initially they told me that I would need nutritional visits of 6 months. So going to the dietitian once a month for 6 months, I would need a 1 year verified BMI, which I already had, because if you get your annual visits, your annual physicals, then 2017 I went to see my primary care doctor, PCP, for my physical. She had notated my BMI, and February of 2018, I also went and had my physical. So that was great documentation for my BMI, which was required by the insurance. Now, so I didn't hear anything from the surgeon from March all the way to July because I've had all these requirements. Now, in April, May, and June, I went to the nutritionist. Now, when I went to the nutritionist, I was going with the thought that maybe she would give me some great tips on how to lose weight or stay healthy in general, and maybe I wouldn't have to have the surgery. Now I knew that just nutrition and exercise, is great. It hasn't worked for me in the past. I had to have, I tried it under the care of a physician, and I had to go on medication to be able to lose weight. So I knew right off the gate that anything the nutrition told me may help me lose a little bit of weight, but it wasn't gonna get me to where I needed to be. So that's my, another reason why I considered going to have the surgery, because the fact that my new medication will contradict with the medication that I was taking in the past, that I was able to lose weight, but can't take it anymore because of the medication I'm currently on. So I went to a nutritionist. It's basically, what did you have to eat in the past couple of weeks? What have you been doing? She gives suggestions. But, on my second or third visit, I realized that basically what she was doing was getting documentation to be able to present to my insurance to show that, hey, I've been trying to manage my weight and it's not working. So it wasn't really like, these are the steps that we're going to do to try to get you to lose weight. Instead, these are the steps that we're going to get you to do to be able to get approved by your insurance. Which, it's okay. I already knew that no matter what I did, that I was not going to lose a significant amount of weight because of my history of not being able to lose weight. I'm not saying that the surgery is going to be, this miracle pill that is going to get me to lose all this weight. I know I have to put work into it. I know I have to exercise, eat right, and all that stuff. Going back to the insurance now, in July, the end of July, I thought I needed 2 more visits for the nutritionist, and I get a call from the surgeon's office basically saying, hey, I got this letter from the dietitian stating that you're on your 3rd visit or on your 4th visit, and you don't need 4 visits. You only needed 3 visits, and on top of that, 3 visits with your primary care doctor stating, that you've talked about weight loss. So now I was a little bit upset because I was like, now great, I'm gonna have to start over. I'm gonna have to, or not start over, but now it's gonna last me longer. Where I thought it was only gonna be 6 months, now I need 3 additional visits with my primary care doctor. So it's gonna be 9 months total. But that wasn't the case. What the surgeon's office explained to me was that I already had 2 visits that year, 2 visits within a year, meaning I had my physical back in 2017, my physical in 2018, and I had a documentation of not a physical, but my my appointment with the doctor that I'm seeing for my medical condition. So that in turn made it to be I had 3 nutritionist visits and 3 physician visits, which it had to be an initial consultation with the nutritionist plus 3 additional visits, which I did have because I was already on my 4th visit. So I had the initial consultation, 3 nutritionist visits, I had 2 physicals, and a general appointment with my physician for my medical condition. So I was like, oh wow, here I am thinking I was needing 2 more nutritional visits, and then go to thinking, oh, now I need 3 physician visits, and that's not the case. And, I did this video to make sure that everybody gets informed of what is required by their insurance. If you're not sure, call your insurance, double check, triple check with your physician, because you may be paying for additional visits that is not necessary to see either the nutritionist or your physicians. Another requirement was to see a psychiatric or get a psychiatric evaluation. My suggestion to anyone trying to have this surgery or procedure is to get that done in the beginning, because that was a process. Now, I say that was a process because I had a very hard time finding a physician who does psychiatric evaluations for weight loss surgery. I called several places where my insurance had provided me the names and numbers of physicians, referrals, or who did psychiatric evaluations or were psychiatric doctors, and each and every one that I called did not take it or did not do the service. So finally, it took me about 2-3 weeks before I finally found someone who did do the service, because the person who my surgeon suggested did not accept surgery. And in hindsight, I should have just went with that person, because the consultation for the psychiatric evaluation for my insurance cost me $175, because I had not met my deductible as of yet. A deductible is a set amount that you have to meet for your insurance to be able to pay any part of any services. I'm sorry, my battery died. I don't know how that happened. Anyway, so what I was saying is that, on the other hand, aside from paying $175 because I didn't meet my deductible, the person who my surgeon's office referred me to was someone who didn't take or accept insurances, and she was charging $172 or $125. I think it was $125. And like I said, in hindsight, I should have went with them, because it was a lot less than I've already paid. I had to pay the psychiatric doctor $175. Now, on the plus side, I paid him the $175. I've now met my deductible. I only have left a co-insurance, and a co-insurance is a percentage that my insurance requires me to pay for whatever services I have. So whenever I have my surgery, I'm going to have to pay the surgeon 25%. And that's where I'm at right now. So all my documentation has been submitted. Psychiatric evaluation has been done, and that in itself was a process. I went to the psychiatric doctor. I've never been to one before in my life. I didn't know what to expect. I was thinking he was going to do a deep dive into my life and tell me everything was wrong with me, and I was too crazy to have the surgery. Because I've heard stories. I'm on the Facebook boards, and I've heard a lot of different stories as to people crying and everything they've gone through. The initial visit with the psychiatric doctor, I was in his office for about 10-15 minutes. He asked me a few questions, and that was it. I was like, that's it. He put me in another room with a questionnaire, and that's what took the longest time. It took about 2 hours. So total time I was in his office for 2.5 hours. And the questionnaire was things as far as, I like flowers, I want to become a mechanic, and it was a true and false question. And I was a little concerned because I didn't understand what that had to do with having surgery. Questions like, I want to become a mechanic? No, I don't want to become a mechanic. If I was an artist, I would draw flowers. I was like, what is that? I like to talk about sex. I'm so confused, but this is what's required, and this is what I'm going to do. So once I was done, I had taken a screenshot, or not a screenshot, but I took a picture of the test, the questions that I was taking, and I sent it to someone who was very knowledgeable about the surgery itself, had it done himself, and I was like, what is this? I don't understand. Why are they asking me these questions? And it was just so confusing. And he said basically is that a lot of people who are overweight, food is their addiction. people get addicted to food, that's why they're gaining weight. And these type of questions are asked because when you don't have access to that addiction anymore, because your stomach is going to be smaller, you're not going to be as hungry, you're not going to be addicted to food anymore. People tend to move on to other addictions, whether it be gambling, drugs, sex, I guess flowers. I don't know. I still don't understand what flowers had to do with this whole situation, because I'm still a little bit confused about that. So I get it. I get that when a lot of people have food addictions, it's a big problem. It's a big part of why a lot of people are overweight. They eat to cover their emotions. They eat when they're happy. They eat when they're sad. When you no longer have that addiction, you move on to other things because you're just so used to being just having an addiction. So you go on to gambling, sex, and he went on to give me more examples that he's seen in real life, and I was like, wow, I think I'm a pretty sane person, and it was just an eye opener, because you never think that people who have food addictions, they would go on to other things. But it, as they always say, addiction is real. Addiction is real, and they want to make sure that you are in the right mindset to have this surgery. Everyone can give all the information that they want. I know I need to lose weight. I know I need to eat right, exercise, and all that. But, this questionnaire is set up to ask you the same question about 10 different ways to see, if you're truly in the right mindset to have this surgery, and are you ready? So my questionnaire was about 300 questions. It was true or false. They did ask the same question in different ways, and it took about a week for the psychiatric doctor to send my information off to my physician. After that, now I'm in the waiting game. I'm waiting for the insurance to see if the insurance is going to approve me. I've done and or met all the requirements. I work with insurances in my life, and it's part of my career. I have seen many patients get denied. So you just never know. You never know if you met all the requirements for your insurance to approve you. That's why a lot of patients don't want to go the 6-month wait time that most insurances require. Like mine was a 6 months waiting period to do everything that is required by the insurance. And they opt to either pay cash or go to Mexico. Not really an option for me. I don't have the funds to pay cash, although the surgeon that I go to, he's pretty reasonable as far as cash prices. And as far as going to Mexico, one, I'm scared to go to Mexico with everything going on there right now. And two, my surgeon's a great surgeon. I see him every day. I see his patients every day. I would want to continue that care here with him and for him to follow my journey throughout. Now, excuse me. Now I know that a lot of people opt to go to Mexico. That's right for them. It just wasn't right for me. So now I'm in my waiting period. I have a date. I'm not gonna share that right now, just because dates change. It very may well be that my date may change depending on what my insurance says. If my insurance comes back with any more requirements, we'll see. And also, I didn't say this in the beginning, but I chose to do the sleeve or vertical sleeve gastrectomy because the other two surgeries I didn't believe was right for me. The other two was the gastric bypass, and that's where they take basically all your intestinal stomach areas and bypass it, and it's a very big procedure. The gastric bypass does take longer time to heal. It's a longer surgery time, and it's mostly suggested for people who have to lose an insane amount of weight, or over 100 pounds, over 200 pounds. And the other surgery is the lap band. The lap band is a medical device that is placed around the stomach and basically not cuts the stomach, but restricts the food going into the stomach. I didn't want to go with that one because that one you have to see your surgeon many more times. It's more visits to I'm not going to say the office. My surgeon does it in the hospital through radiology, and it's more, I think it's more costly in hindsight when you add up all the visits, because you have to go to adjust it to a size that's good for you. If your tool, what they call it, is no longer working, then you have to get it adjusted. As much as I love my surgeon, I see him plenty in the hospital. I don't want to have more visits than I really need to. So I chose the vertical sleeve gastrectomy, or what they call the sleeve. It's for people who want to lose from 50 to 70 pounds. Some people do lose more. It just pertains to how their structure is built. And yeah, that's what I decided to go with. I'm currently in the waiting period for the insurance. If you want to see any more videos, I'm currently I'm slated to have my surgery in about 1 to 2 months. Again, I don't want to give a date because those dates change. When I know for sure that that's my date, we'll go through the pre-op process. Like I said, I work in the hospital. I see the process every day. I know, what these patients go through if they have to come back, what they come back for. And I'm more than happy to share my journey as well. And that's what I want to do. I want to go through the pre-op process with you all. I want to go through my surgery date with you all. I want to go through, week 1, week 2, the diet. I looked at the doctor's diet required to 2 weeks prior to the surgery, and it's insane. A lot of people say that it's just like clear liquids, or they can have broth, soup, but I read the one for my surgery, and it's going to be tough. It's going to be a tough journey. I'm definitely willing, for my health. Number one, I don't want to be on medication for the rest of my life, and that's why I'm doing this. I didn't take this route lightly. I felt at this time in my life that it's my only option, and I have a family, as you all do, and you would do anything to make sure that your health is protected, or do whatever you need to do for your health to make sure that you're okay for your family's sake. Again, once I get approved or denied, I will share that news and share with you all what the next process is. If you're interested in these videos, you're more than welcome to subscribe. If you want to know when I post, you're more than welcome to hit the little bell, and you will get notifications on your email, phone, text. When I get notifications for videos that I watch, I get them on my phone, and I get them on email. Again, I hope you like this video, and I'll talk to you soon. Bye.